Okay, perfect. Okay, excellent. Hello, everyone, and welcome to my webinar on how to support anxious children and adolescents in being brave. Love to see some familiar names in the chat, and a former professor. So wonderful to have everybody here. So let's dive in. So to help set the stage for today's topic, I'm going to start with a quick crash course on anxiety. So what is anxiety? Anxiety is one of the countless emotions that we experience in our day-to-day lives. The American Psychiatric Association defines anxiety as the anticipation of future threat. I often refer to anxiety as one of our bodies, or as our body's internal alarm system, which alerts us to potential danger. And anxiety in and of itself is not a bad thing. It really functions to keep us safe from threats and ensure our survival as a human race. However, it can become problematic when we experience excess false alarms, when our anxiety gets triggered despite our not being in true danger. So there are three ways that anxiety presents itself in humans. We experience anxious thoughts, anxious sensations in our bodies, and we engage in a range of behaviors when we are feeling anxious. And these thoughts, feelings, and behaviors, they're all connected. They have a drastic impact on one another to either further heighten our anxiety in different situations or help us to calm ourselves down and think rationally. So let's explore each in a little bit more detail. So when it comes to physical sensations associated with anxiety, no two people are alike. We all have unique experiences with how our personal body reacts to anxiety. Some of the most common physical symptoms of anxiety are listed here. So body and muscle tension, increased heart rate, which can result in breathing more quickly, nausea or stomach aches. Kids might describe this as butterflies or knots in their stomach, trembling, shaking, sweating. Some other sensations not listed here include dizziness, headaches, pain or tightness in the chest, blushing, where your face might get red, your neck or your chest might get flushed as well, tingling in your extremities, and feeling faint. When it comes to our thoughts, there are a few themes that tend to come up with anxiety. First are worried thoughts, in which we are anticipating an unwanted stressor to occur. An example of this might be, they're all going to laugh at me. Sometimes our anxiety takes it to the next level, where we may expect the worst case scenario to occur. An example of this might be, what if I forget everything I studied during the exam? And our anxious thoughts can also involve setting unrealistic expectations for ourselves. So I'm going to disappoint my teacher if I get one question wrong. So you could see through some of these examples that anxiety it actually causes us to think more irrationally. And when it comes to behavior, again, a few themes tend to emerge here. By and large, anxious children, adolescents, and even adults tend to avoid or stay away from situations that trigger anxiety for them. So some children might be a chatterbox when in the presence of familiar friends and family, but go silent when they're in the presence of strangers. Someone who is fearful of small spaces or elevators, they might take the stairs whenever that's possible. Or if you're frightened by big dogs, you might cross the street whenever you see one walking your way in your neighborhood. These are all examples of avoidance. Another anxious behavior is over-preparing for a future stressor. So for young children, this can look like asking parents excess questions about an upcoming vacation, or teens might study hours and hours and hours despite their already being at the top of their class. And finally, one may engage in a specific ritual to seemingly to seemingly prevent a feared stressor from taking place. So we might see this in a child engaging in a very rigid morning routine to ensure no one gets harmed on the way to school. So they might need to brush their teeth, get dressed in a certain order in a very specific manner where they're putting their socks on first and then their pants on, and maybe they need to have their hair done in a very specific way, say certain things to their parents before they walk out the door. Again, thinking of what I said with the anxious worries, these behaviors may not always be rational. So it's important to know that children and adolescents' attempts to avoid feared situations, it's their solution to the problem. If a child is fearful about being away from their parent, they're going to do whatever they can possibly do to avoid that uncomfortable feeling of being away from them. So that might be clinging to their parent, crying or screaming. And such avoidant behavior can help to reduce their anxiety in the short term, in that immediate moment. So clinging to their parent gives them access to their parent a little bit longer, which is going to momentarily prevent their parent from dropping them off at that play date. So these anxious behaviors, they work. They help the child feel momentarily better. However, if these behaviors are effective in avoiding their feared situation time and time again, it's actually only going to strengthen that fear and strengthen that anxiety. So I'm going to demonstrate this with an example. Many of the children I work with here at MPG experience anxiety when they have to speak in front of the class. So imagine this scenario. The teacher asks them a question in front of the class. This triggers anxiety for the child. Maybe coming back to our thoughts, feelings, and behaviors, maybe they're worried, what if I get the question wrong? This thought might cause their heart to start racing and their hands to start trembling. And because of this spike in their physical anxiety, they freeze and actually avoid answering. Generally, when we as caring adults see kids in distress, we in turn also experience a spike in our own anxiety. So what does that anxiety cause us to do? Generally, we might jump in and rescue that child from distress. So the teacher in this scenario might remove the expectation that the student answer by maybe answering for them or going to another student and having them answer the question instead. This will result in a short-term reduction in both the student and the teacher's anxiety, because the trigger in terms of, the anxiety of having to speak, we've removed that. So now we're both feeling better. We got through that awkward situation. But what happens is that the student is more likely to repeat this behavior in the future. And if we're more likely to repeat this behavior, it's possible that the teacher or whichever adult is going to rescue them again, and it's only going to maintain these symptoms of anxiety. We call this negative reinforcement. So negative refers to removing the unwanted stressor. So in this situation, the expectation of talking in front of the class, we're taking that away. And reinforcement refers to the likelihood that this behavior, this cycle, will repeat itself because it's helping the child to feel better in the short term. But if you imagine how many times this child has successfully avoided speaking in front of the entire class, odds are this is happening hundreds, probably even thousands of times, depending on how old the child is and when this anxiety first became a problem. So again, the more they avoid it, the more intense that fear will become in the long run. So in a nutshell, this vicious cycle demonstrates that even well-intentioned adults can inadvertently strengthen the child or adolescent's anxiety because they are removing that stressor causing the anxiety rather than letting that student sit with that uncomfortable feeling and sit with that discomfort. Okay, so let's move on to talk about how caregivers can play a role in their child or adolescent's anxiety. So if you are a parent or a caregiver of a child or a teen with a history of anxiety, you've probably experienced times in which you felt torn about how to handle fearful situations. You may have thought to yourself, this is terrifying for them. Should I rescue them from their fears? Or their peers can do it. Should I just push them to face their fears? If either of these thoughts resonate with you, you are not alone. And for those of you who fall in line with my thought bubble on the left, my next slide is for you. So research has found that all mammals' brains are hardwired to protect and rescue their youth. We aren't born with the basic tools and skills for survival. In fact, young mammals are terrible at ensuring their own safety, making sure that their needs are being met, and self-soothing. So naturally, they rely on their parents to do these things for them. And mammalian parents are extremely attuned to their child's fear cues. So when in fear, children are incredibly skilled at drawing their parents in. You could even see it in this picture on the bottom. The child is clinging to their parent here. And their parents will immediately respond without even thinking about it, reading these cues and help calm their child to feel better again. So supporting children through anxious situations is not intuitive. In fact, I frequently work with families where parents and caregivers fundamentally disagree in this area. One parent or caregiver may feel the need to really relieve their child's distress and help them avoid feared situations, just like we were showing with the mammals in the last slide. So we refer to this as protective parenting. While the other parent might feel the need to really challenge their child to be more independent and just get over it. So we refer to this as demanding parenting. And the good news is that both of these seemingly opposite perspectives are correct. In fact, the key to promoting bravery in anxious youth is to combine both protective and demanding parenting. Dr. Eli Leibovitz, professor and clinical psychologist at Yale University, calls this combined approach supportive parenting. So one way parents can articulate this kind of support to their child is by using what Dr. Leibovitz calls a supportive statement. Supportive statements have two main ingredients. We want to accept and validate the child's fearful experience and simultaneously exude confidence that the child can withstand slightly more discomfort than they have up until this point. So here are some examples of supportive statements. It frightened you. That's the validation piece, but I know that you'll be okay. Confidence piece. Next one, my job is to help you build your independence. And it may be difficult, and I'm confident that you can manage it with practice. So all three of these statements really communicate a message of seeing that this is difficult for the child, but also knowing that with the right supports in place, with their parents, with their loved ones, with practice, they can overcome this fear. So we're kind of flying through this. So I'm hoping for some group participation here. We're going to practice coming up with supportive statements together. I'm going to provide 3 quotes, one at a time. And for each one, I want you to first type into the chat whether the quote would fall under protective or demanding parenting, and then rephrase it into a supportive statement. So some things to keep in mind. There's no right or wrong answers for the supportive statements, as long as you combine both ingredients of validation and confidence, you are correct. So make sure to plug it into the chat instead of the Q&A. We're saving Q&A for more complex questions for at the end. So I have the chat open. So let's look at our first one here. She can't handle it. Do you think first that this is protective or demanding parenting? I'm seeing a combination of both, but it looks like protective is outweighing the demanding. Exactly. So when we're saying something like she can't handle it or he can't handle it, we are conveying a message that this is going to be overwhelming for them and that we're going to have to dive in and provide support. So any brave participants that want to take a stab of a supportive statement. So I see she is struggling, and I believe with help we can do this. So thank you, Hattie, for being a brave volunteer here. So Jacqueline is saying it will be hard, but she can do this. So love how both of these are, again, validating and encouraging. Ooh, I'm seeing a bunch come through. I know this is difficult. Together we can get through this. I will help you. I want to help you get through this. Wow, love how many people are coming with supportive statements. It's actually hard for me to get through all of them, but this will be a challenge. But with practice, she can do this. I can help you. Love how quickly everybody's adjusting to this 2-ingredient supportive statement. So the one that I put together, but again, there's no right or wrong. I saw some truly excellent ones in the chat. It may be tough, but she can get through it. So let's look at another. So protective or demanding parenting. Come on, this isn't that scary. Okay, I think the contrast is pretty clear here. So I'm seeing demanding, demanding, go all the way down the line. So everyone is correct. So how might you rephrase this into a supportive statement? It's okay to be scared, but we can be brave and try it together. Thank you, Vanessa. I know this is scary for you, but we can do it together. Liz, I know it's scary. I think you can do it. A lot of similar supportive statements here. I love how everyone, again, is including those 2 ingredients. So the one that I put together is, I know that you can do scary things with some practice. So again, no right or wrong here, as long as we have both ingredients. I see Vanessa plugged in. Sometimes the first time is scary, but then you get experience and it isn't scary. Love that. Wow, lots of similar ones there. Okay, for our third example, she needs my protection. So protective or demanding parenting here. Yep, already seeing some answers. Protective all the way down the line. So how might you rephrase this one into a supportive statement? This one's a little bit different than the last 2. We can do it together. Love the emphasis on we. Communicating to your kids that they're not alone in this. You're there to literally and figuratively hold their hand through it. She needs a little encouragement, but we can do it, from Suzanne. Oh, a whole bunch came through at once. Lindsay, I'm always here to support you in doing new things. Love that supportive statement. Excellent. She may be nervous, but I can be there as she needs, from Elizabeth. Wow, love how many people are plugging in supportive statements here. We've got some brave volunteers. So the one that I put together, I'm here to help you build your brave muscles. And I definitely saw some that were similar to my supportive statement here. So thank you everyone for your participation. And I think, yes, that brings us to our first poll. So we've got 2 questions here. True or false, well-intentioned adults and caregivers can help children overcome their anxiety by protecting them from being in stressful situations. And I'll read the second one while you guys are answering. Select the best supportive statement below. A, this shouldn't scare you. All your friends can do it. B, this is so difficult for you. Let me help you. C, this might feel a bit scary at first, but I know it will get easier with practice. And D, you're so delicate. Okay, so looking at the polls here, I'm seeing overwhelmingly false answers for number 1. And for number 2, 98% of people are picking C. So it looks like a little bit more than half people have answered. I'm gonna go ahead and reveal the answers here.
Okay, I think everybody can see them. Yes. Do you want to stop sharing?
Sure.
Okay.
So sharing results. Excellent. So it looks like you guys are doing great on these polls. So number 1, the answer is false. And the trick is right there at the end of the statement. So intentioned adults and caregivers can help children overcome their anxiety by protecting them from being in stressful situations. Our goal here is to be supportive for them, and we're going to talk more about this in the next section, but supporting them through stressful situations rather than protecting them. And our best supportive statement is C, because it has both of the acceptance, validation, and confidence ingredients. This might feel a bit scary at first, but I know it will get easier with practice. Okay, great.
I'll stop sharing. Dr. Harvey, there's actually a question I think pertains to this section that you were
great.
Speaking about. So I was just going to ask, somebody was asking, at what age should you use those supportive statements?
Okay, thank you for that. I think these supportive statements, Dr. Eli Leibowitz, who developed the supportive statement through his SPACE program. So SPACE stands for Supportive Parenting of Anxious Childhood Emotions. It's designed for children all the way up to adolescence. So much of the slides and much of what I'll say today is children. Every once in a while, you'll hear me sneak in a teen or adolescent, but many of these do apply to teenagers as well. A lot of this will be customizing your exposures, which we're going to talk about in a moment, to make sure they're developmentally appropriate and clinically appropriate for that adolescent's need. So I do think you can use these all the way up to adolescence as well. And I even think in certain situations, you could use this with adults. I think you can use supportive statements when you're working with your coworkers who might be feeling anxious for a presentation that they're doing, that you can validate that and also remind them how they totally killed it on their last presentation and they can do well this time. So I do think you can apply these to adults as well. I see a question, what is the youngest? I don't think that there's a really limit on supportive statements. I've seen people use it probably with kids as young as 2. But even when kids are younger, they're picking up a lot of the language that you're using and the messages that you are conveying. So I don't really think that there are age limits here, as long as we're using language that kids can understand. Okay, hopefully that answers all of those questions. So that brings us up to our final bit of today's webinar. We're going to have lots of time for discussion. So as more complex questions come up, definitely plug it into the Q&A. But we're going to go into how parents and caregivers, and this includes teachers, can build bravery through exposures. So this brings us back to the negative reinforcement cycle of anxiety that we reviewed earlier. The key to building bravery is to interrupt this vicious cycle here at the point of intervention. So when parents and caregivers can take the supportive stance that we were just been discussing and simultaneously refrain from rescuing children from feared situations, children will learn to get comfortable being uncomfortable and building distress tolerance. So what is this thing called exposures? Exposures are when we practice approaching situations that trigger fear, anxiety, or discomfort for us. We aren't just doing this one time though, but many times with repeated practice, children will increase their distress tolerance, build bravery in the face of their fears, boost their confidence and self-esteem, and better cope with all of those uncomfortable feelings associated with anxiety. However, it is important to keep in mind that these positive changes don't happen overnight. They require time, patience, and lots of practice. The key to exposures is to take small steps that gradually increase in difficulty, starting with practicing areas of low anxiety and getting more and more comfortable in this area with repeated practice before targeting areas of moderate anxiety and ultimately areas of high anxiety. And when I say getting comfortable being uncomfortable, that's going to look very different from child to child, adolescent to adolescent. You know, some kids, once they get some practice, they really build that bravery and confidence, and they feel motivated to go forward and actually have a lot of fun doing the exposures. Other kids that have more moderate to severe anxiety, they're really going to take, it's going to take a lot of effort to engage in every exposure. And maybe they never get to a point where they're like looking forward to it or powering through it. They might be undergoing a lot of distress throughout, but maybe they get to a point where they're comfortable enough. They're still uncomfortable, but they can better tolerate it. Then maybe we can turn up the heat. So it's super important to keep in mind that every child is unique, and some may call for more support or smaller steps or more repeated practice than others at one particular step before they're ready for step 2. So consulting with a licensed clinician who specializes in treating anxiety is really going to help you find the best plan for your child's specific set of needs. So I thought I would end today's webinar with some examples of low, medium, and high level exposures, as well as some individualized supportive statements for 3 anxious behaviors that I frequently see. However, I again want to caution you that even if your child struggles with any of the examples I'm about to go over, the listed examples of exposures may not be appropriate for your child. So no 2 kids are alike. Every child will need to proceed with exposures at their own pace to best set them up for success. Okay, so with that said, our first example is going to cover reassurance seeking. As a reminder, reassurance seeking is when children or adolescents frequently ask questions or repeatedly check in with their parents or teachers regarding their worries. So for some children, they might ask the same question repeatedly, even if you just answered it. So for example, some children are anxious about making a mistake. So they might ask, did I do something wrong? Several times over, even if you just told them no. Other children might ask an excess number of questions about a specific topic. So for example, if they're anxious about a babysitter coming that evening, they might be asking which babysitter is coming, what time are they coming, what time will you be back, will you be putting me to bed, what if I need you, will you pick up your phone if I call, etc., etc., etc. So reassurance seeking can look very different child to child. So one potential exposure parents and caregivers might do is put a limit on how many questions they will answer in the morning, afternoon, and evening. Some children might tolerate starting with 3 answers in the morning, afternoon, and evening for a low-level exposure, and then proceed to 1 answer for a mid-level exposure, and working your way up to 0 answers by the time we get to a high-level exposure. Another option is they might put a limit on how many times the parent might answer a repeated question. So maybe, let's say the child is asking questions 5, 7, 10 times over. You're going to start with one number that feels like a reasonable amount, slightly more discomfort than they were able to tolerate before. So maybe you're only answering 3 times. And then you decrease it to 2 times and work your way down again to providing 0 reassurance. Okay, that brings us to a potential supportive statement. So you're going to see this supportive statement is a little bit different from the ones I showed you earlier because it is very targeted to this specific example. So I know it bothers you when you're unsure if you did something wrong, but I'm confident you can handle not knowing. So maybe you would use that supportive statement when you're at the high level exposure. All the supportive statements we used earlier would also be appropriate when you are refraining from providing reassurance, or maybe you're just giving 3 times or 3 instances of reassurance. You could still use those non-specific ones. But when you are doing very targeted exposures, I like making them very specific so that we're helping them know what we're confident that they can handle. I see a question came in, and I know a bunch of them have come in. We're definitely going to get to as many as possible, but what if supportive statements actually turn into reassurance? That's very related to this slide. That's a great question. I think if you see that the child is becoming dependent on the supportive statement, we can again put a limit on it. So in other words, I wouldn't want you in this situation to just replace answering the question with a supportive statement. If you're just giving the supportive statement and it's taking that place of providing reassurance, we may not be helping them to build distress tolerance. So maybe you're saying the supportive statement once, maybe twice, but then you're walking away. Again, this is where working with a clinician, I think, will be key because there's so many other factors involved in doing exposures. The child's response to you giving the supportive statement and their response to you not giving them the reassurance that they're looking for. A clinician would be able to work with you to give you very concrete strategies of when to cut off that communication and when to walk away. Maybe they'll brainstorm with you supportive coping skills that you can use to help you get through it. Because as we said before, when we see an anxious child in distress, we get anxious, we feel uncomfortable because we naturally want to help them. Our mammalian instincts are kicking in that moment. So that's where working with a clinician can really help you with those subtle the subtle things that can happen while doing an exposure to make sure that we're not giving into the anxiety, but instead we're helping to set the stage for success. Okay, I'm going to go through the other example. So our second example covers when children go mute in the presence of strangers. So this might be with wait staff at a restaurant, the cashier at a grocery store, or an Uber driver. Again, at the risk of sounding like a broken record, each child's starting point for exposures in this area will greatly vary. But imagine this scenario. The stranger asks your child, "What's that stuffed animal you've got there in your lap?" And kiddo anxiety comes up and they freeze. One parent might start by repeating that question and supporting their child in answering the question in front of the stranger. Once they've had repeated success with answering their parent in front of the stranger, then maybe the parent is supporting their child and providing a one-word answer to the stranger. So maybe they're able to say, maybe they're looking at the stranger, maybe not, but maybe they're able to say lion. And a good long-term goal, again, this would be after tons and tons of practice, this is a big leap clearly from our low-level exposure, would be to have the parent support the child in providing a full sentence answer. So maybe the kiddo is saying, its name is Simba. So, supportive statement. Talking to strangers can be scary. And I'm 100% confident you can start by speaking to me in front of the ice cream man. It's a little bit wordy, but again, you can use those shorter ones that I went over earlier. Okay, and for our final example, some kiddos have very rigid and lengthy bedtime routines. They might prefer certain scripts are said between the parent and child at very specific times. They might prefer doing certain tasks in a very specific order in terms of when they brush their teeth, when they put their pajamas on, when they read a book. So parents might start with targeting flexibility and changing the order in which certain tasks are done. They might increase the difficulty by reducing the amount of time they spend maybe laying down with the child when they're trying to fall asleep. And finally, parents might work their way up to giving very quick goodnight hugs and kisses and immediately leaving the room, allowing the child to fall asleep on their own. So anybody want to be a brave volunteer and give us, plug in the chat, an example of maybe a more individualized supportive statement for this example? Sometimes even I need to think when I'm working with families of like, oh, this is a tricky situation. How would I make this into a supportive statement? So it's okay if you're trying to wrap your mind around it and exactly how you'd want to word it. I'm seeing lots of good questions in there. Okay. So Brandy's saying, I know you're used to putting on your PJs first, but tonight let's brush first. We can do it together. Let's have a little fun and try switching things up tonight. Betsy saying, trying something new can make you stronger. Let's do it this way tonight. Love the emphasis on making it fun and engaging for the child. Oftentimes in treatment, we want to incorporate playfulness and games to help the child be able to access this. Brushing our teeth with our left hand makes our brain stronger. Oh, thanks, Vanessa. I like the creativity there. A lot of this does require being creative and thinking outside of the box. Patricia, I know you do not want to sleep alone. I will leave the door open so you can feel closer to me. So love that little stepping stone of ways that you can give support, but still be a little bit more distant and provide that independence to the child. So thank you everyone for volunteering some supportive statements. The one that I came up with is it can be difficult to change our routine, but I'm sure you can practice being brave and flexible. So like I said, there's no right or wrong here as long as we are both acknowledging that this can be tricky and challenging for the child, but exuding that confidence that they can tolerate a little bit more discomfort than what they've tolerated up until this point. So thank you everyone for being so engaged in the chat. This brings us to our final poll question. Exposures: A, help to build distress tolerance. B, provide opportunities to face your fears. C, target low areas of anxiety before high areas of anxiety. Or D, all of the above. Writing these questions just brings me back to high school and SATs. So I had to put an all of the above question in there. And it looks like we've got 100% people selecting the bottom or just close to 100%. So thank you everyone for being so attuned and focused in today's presentation. We can go ahead and stop sharing that. And then a couple other bits before we move on to Q&A. Oh, there we go. Okay, so if you would like to find out more about supportive parenting, I highly recommend you purchase Eli Leibowitz's book, Breaking Free of Child Anxiety and OCD. It's an easy read, free of jargon, and we'll go through countless more examples of anxious behaviors and how very well-intentioned adults can totally inadvertently reinforce the child's anxiety. Here are a few references. Again, thank you everyone for your participation today. I hope you're all walking away with a better understanding of the caregiver role in childhood anxiety and how you can support your loved ones and your students in building bravery and distress tolerance. We certainly can move on to Q&A at this point. And I guess I should stop screen sharing. Is that correct, Kristen?
That's fine. You can do that.
Okay.
Do you want me to start by asking you some of the questions?
Yeah, that would be great because I saw a bunch come through and I didn't get a chance to sort through them.
Somebody's asking, what if it is not possible to avoid the high anxiety area without being able to start small? How can we help with high anxiety situations?
So I would say with high anxiety situations, sometimes we need to break that down into smaller steps. And it doesn't always fit as nicely as, you know, the way I broke it down in some of those examples. But if you think of it really in terms of shaping, where maybe they're doing a segment of that behavior, that ideally is how we would want to approach it. It definitely takes a lot of creativity. Some kids, as I said, might need to move very slow. So like I have a teenager, for example, that's having a hard time talking with peers in school. And even just engaging in eye contact. So in our sessions, we might engage in games or activity where we are practicing eye contact. And maybe looking eye to eye is too intense and too uncomfortable. So we might start with using tools where maybe they're looking at my shoulder first and looking at my ear. And then if I'm like wear a mask, they can look down at my mask before they look at my nose, before they look at my eyes. So it's all about being creative and thinking, how can I take that high level exposure and break it down into smaller steps?
Thank you. Heather's asking, can you help come up with a statement about a child's super high anxiety about being late to activities?
And that was for a supportive statement, correct?
I think so.
Okay. A supportive statement for being late. And I guess some of this might be, it could be helpful to get an understanding of why it might be hard to walk in late. And not all kids are able to communicate that. But for some, it might be having all of their eyes on them. Others, it might be, you know, missing content that might be on Friday's exam. So if we're able to gather a little bit more information, I think that could help you provide targeted exposures and supportive statements. But we don't always have that information from kids. Not all kids, especially kids maybe like 7 and under, are able to communicate the why of their anxiety. So it can feel uncomfortable to walk in late to class, but I'm confident you'll be able to start your work once you get to your desk. Again, I'm just kind of making a guess of the situation, but that might be a way that I provide that supportive statement.
Thank you. Can I ask another question about supportive statements? Somebody's asking, somebody asked if you could make a supportive statement about test anxiety.
Mm-hmm. And it looks like that might, I see it somewhere in there. I can't tell if it's Joseph or Josephine. I'd be curious to know, academic anxiety, especially if the student knows they have a learning disability. You could see that it even takes me a moment to really wrap my head around the situation. It's natural to feel nervous about an upcoming exam. And I'm confident you'll be able to do the best that you can do on that exam. It's hard to know exactly what the learning disability is, but I think if we're just exuding the confidence that they can try the hardest that they can, we don't expect them to get perfect scores, but as long as they're putting some effort into it, that we're seeing that as a win. I do have some kids I work with that they think that they're going to forget everything that they've studied. So sometimes some of that, the clinician can support the child in challenging some of that thinking, and really gathering a history of whether that's happened before, that they've submitted a completely incomplete exam. So that may be helpful in thinking it through with your kiddo, but it does look like they have a few different learning disorders. So yeah, I think just validating that tests can be tough and we don't expect perfect scores, but we're confident that they can sit through it and fill in as much as they can. I saw a question about the book recommendation. So I'm just going to read the title, but you should be able to see it in your slides: Breaking Free of Child Anxiety and OCD. It's available on Amazon. So feel free to just plug that into Amazon and you'll see it come up. It's by Eli Leibowitz from Yale University.
All right, thank you. And there's so many questions. Somebody's asking about a specific thing. She's saying, my child is 5 and refuses to use the school or public restroom. She goes only in her home. Is this an anxiety sign?
So sometimes we might see that with some kids with anxiety, difficulty using school or public restrooms. That in and of itself is not a disorder, but it's not uncommon to see that with kids who might have social anxiety. Again, it's not a rule, but I often see that social anxiety, for those of you who are not aware, is when there's like a fearfulness of being negatively evaluated by their peers, not so much adults, but people their same age, or fearfulness of being embarrassed in front of them. Some kids though, it depends on what the root of the behavior is. Maybe there's a fear of like contamination or germs inside the bathroom. So again, no two kids are alike. So we might see that rigidity around where they use the bathroom for a few different areas of anxiety. So that might be something that you could practice using public bathrooms elsewhere, whether you're going to a library or a movie theater or somebody else's house or a doctor's office. Maybe they just need to do some exposures around using other bathrooms.
Okay, perfect. Katie's asking, what if the anxiety isn't readily accessed by the caregiver, but results in withdrawal and internalization? I think she's asking, what if it's not noticeable, or what it's very internal?
Mm-hmm. Yeah, and I'd say that is a common problem with kids with anxiety, that especially in school systems, they can fly under the radar. Usually the squeaky wheel gets the oil. So the kids that are more disruptive in the school setting are the ones that might be referred for outside services. Whereas kids that tend to more internalize, we may not always be aware of what their challenges are and what's going through their mind and what's going through their body. So really checking in with teachers to find out if you are seeing them socializing appropriately with their peers, like if they stick out at all in the classroom or in structured or unstructured settings amongst their peers, that might be cause for concern. Like sometimes it does warrant asking more specific questions to teachers. But I guess, you know, it's hard to answer that question further because I'm not sure exactly what the concern is if it's not observable. But hopefully that helps you like think about what are some things to look out for.
I hope that answered your question. There's some questions about like households and split parenting. One person is asking, what can I do about a student that has high anxiety about visiting the non-custodial parent? It's impacting classroom performance. And somebody else on a similar topic said, if your child splits time between parents' homes, is it normal that they might go through independent steps a bit later?
So I guess in response to the first question, if any teachers are seeing that anything is kind of getting in the way of the child being able to access the curriculum, getting in the way of their socializing with their peers appropriately, if there's any way in which your students might stick out a little bit to you, I would recommend just communicating it to the parents, especially if it involves like lack of speech as well. Sometimes parents may not be informed about these things until months later. I've also worked with schools and teachers that are so on top of that and super communicative to parents, but I would definitely inform the parents. And if you're still seeing it intervening in their functioning in school, you know, talk to an administrator. I don't know if there's a school counselor or a school director, and see if it's appropriate to recommend outside services. You could always provide referrals to MPG or your local providers to ensure that the family and the child especially is getting the services that they need to be able to access the curriculum and engage with their peers. I would just say consistency, you know, when kids are in two different households, consistency across parents and communication across parents is really going to set the child up for success. Can you remind me what the second question was? Because I feel like I didn't address that.
It says if your child splits time between parents' homes, is it normal that they might go through independent steps a bit later?
Mm-hmm. I think that's where I was getting at with the consistency piece, that like if there's not consistency with, for example, like what the child is expected to do at home independently or with their morning and evening routines, you might see a little bit of a mismatch. In general too, if it was kind of like a stressful separation and, you know, it's possible that stress may have prevented them from being able to meet those milestones at a certain point. So again, touching base with each other and seeing if you can create as much consistency and as much of a routine as possible. Kids really benefit from structure. Same thing in the classroom. And I know teachers use that a lot in their classrooms as well. So the more you can have routine, consistency, and active communication is going to help the child maybe catch up. And if there are any concerns in that area, again, consulting with the clinician, they can let you know, if the child is behind developmentally in that area and how you as the parents can support them.
Great. Thanks for answering 2 questions at the same time. We have so many questions. For the ones that we won't be able to get to today, we may be posting the answers to some of these on our social media accounts. So stay tuned. And I do think all of these questions are great. I wish we could get to all of them, but we only have a couple of seconds left. Should we do one more, Dr. Harvey?
Sure, we could do one more. Mm-hmm.
Okay. How does this look if the parents are also highly anxious? Is there usually a correlation between highly anxious parents and highly anxious children? And can this work be effective if the parents are also anxious?
So really fantastic question. There is definitely a genetic component to anxiety, just as you would see it with depression or ADHD. So the apple does not fall far from the tree. Just because a parent has anxiety does not mean that the child is destined to have anxiety, but it does mean that there may be a risk of them developing anxiety at some point in the future. But it's also good to keep in mind, how parent may be coping with that anxiety. If they are visibly anxious in different situations, it's possibly that they could be modeling that feared response for the child. So in that situation, I definitely would consult with a clinician to ensure that we are helping to educate the parents of a way to best support their child, but also making sure that the parents are getting the support that they need to be able to best support their child. Maybe that parent may benefit from having their own individual counselor or therapist so that they have someone they can go to for their own anxiety and fears. And then they would have the child clinician to really hold their hand in how they can support their child in doing exposures. And I do think, and I think I saw a question in the chat at one point about this, that you can use your own anxiety, again, only sharing what's developmentally appropriate for a child to know. But I think if you could say, like, this was really challenging for me to raise my hand when I was your age in school. I always felt nervous when the teacher would call on me. And this way you're, again, normalizing and validating that your child is not alone, but also showing ways in which maybe you've either overcome that or ways in which you're currently practicing getting outside of your comfort zone. Because then when you do exposures, you can have it be like a project that you're both working on. You're both working on building your brave muscles, and you can do little celebrations together to celebrate any successes in which either of you had in confronting your own fears.
Thank you. I like the large array of all the questions that were asked.
Yeah.
And it is 1:02, so we're going to have to finish for today, but I do want to thank you, Dr. Harvey, for speaking and sharing all of your knowledge on this topic. Those of you who are interested in more webinars with us, all of our events are free, and I did post the link to our calendar in the chat. I can post it again if you'd like, and I'll leave the webinar open for you to use.
Yes, thank you again, everyone, for your questions. I apologize we couldn't answer all of them, but we'll do the best we can so that you can access it in the future. And again, thank you for your participation. Love all those supportive statements already just after one webinar.
Great, thank you. Have a good one.
Bye.
Bye-bye.